my name is Benjamin. I'm a student nurse here at the College of Nursing. Today I will be demonstrating my NG tube insertion checkoff. So here I'm going to scan the room. Place this down. Okay, so of course the first thing that you are going to do you're going to do is verify the order as well as the hospital policy. I'm going to perform hand hygiene before identifying my patient using two identifiers. At that time, I'm also going to assess for allergies. You want to provide as much privacy as possible while doing this. And afterwards, you want to explain the procedure to the patient. So this is Jaguar J. Jones, date of birth 08/25/1963. MR number is 4176352. He's allergic to penicillin. It matches up with the MR and on the wristband, so everything checks out. Then I'm going to explain the procedure to Mr. Jones. So today we will be inserting a nasogastric tube through your nares. So after that, you are going to want to gather all of your equipment, which I have all right here. Usually I would don my goggles, but I don't have my goggles today. So I'm just going to verbalize that I'll don my goggles, perform hand hygiene. I would lower the bed at a good working height. I would lower the side rails. And then after doing that, my pulse oximeter. I'm going to take my pulse oximeter, apply it to my patient. I'm going to take my stethoscope right here. I would auscultate the bowel sounds. So for the pulse oximeter and vital signs, you're going to want to monitor those closely through the procedure. If you have a rapid deterioration of either one of those, you want to stop the procedure, and you want to continue later when the patient is deemed stable. So after you do that, you're going to raise the head of the bed to a high Fowler's position. You're going to come up with the universal Q sign for your patient. So me and my patient have agreed that the universal stop is going to be our Q sign. So after that, I'm going to open my NG tube. Okay, it's stuck. And open my NG tube. I already have my dog ear tape applied from my separate video. So I'm going to apply a dollop of lubricant onto a clean open spot on the packaging. And I'm going to get my tape ready. Okay, I feel like you can't see me enough, so, okay. So now that I have the tape in position, normally I don't have my piston tip syringe here with me. Normally I would loosen the plunger. Don't have it today, so I'm just going to verbalize. After that, I'm going to apply clean gloves. So here I'm going to just check the patency of my patient's nares. I'm going to include one at a time, ask them to sniff. You're going to want to stick the tube into the more patent nostril. So I'm going to include. And then I'm going to take an alcohol swab, clean the bridge of the nose. After I do that, I am going to place a towel on my patient's chest, basin, on the abdomen. I'm going to come over here, grab my tube. I'm going to coil it up like so, and then I'm going to release. I'm going to lubricate the first 4 inches into my lubricant from earlier. Place the tubing into my basin. I have the basin here in case, I need to catch any emesis. So as you're inserting, it's important to not force. It's important not to force against any resistance. So you're going to want to put it in the more patent nair. So for my patient, it's going to be the right. I also have his water right here. He's going to be taking sips while I'm inserting. So when he swallows, that's when you're going to want to, try to get it in there. You want to go 1 to 2 inches at a time while rotating at a 180-degree angle. You want to go until you reach your dog ear tape. So there we go. So I've reached my dog ear tape. If the patient coughs, if there is a O2 sat drop, or if there's any signs of respiratory distress, I would withdraw until breathing is normal. When I would want to continue, I would ask the patient to swallow again, and then I would proceed with caution. So now I'm going to take my tape that I had secured, and I'm going to tape it to the cheek, secure it to the cheek temporarily. Oh my goodness. Like so. Then I would take my piston tip syringe. I would connect it in here. So it's connected, and then I would aspirate. So there's 3 ways to know if you have correct placement. So aspiration of, stomach contents, pH. You can use pH strips, and then the last one is X-ray if indicated. So after you do that, you're going to remove the cheek tape. Sorry, that is my dog. She's in her kennel because she runs around. She's too crazy. So now I'm going to try to attach this tape to the bridge of the nose. It's getting stuck on my gloves. Oh my goodness. There we go. So I finally got it attached to the bridge of the nose. I would clip the NG tube to the gown. I would give my patient enough space or slack so he can move his head. Really, it's according to hospital policy. I would remove the piston tip syringe. I would insert my Salem sump syringe in here. If I wasn't using it, I would cap like so. But okay, so it's inserted. So I'm gonna turn it on to low intermittent suctioning. I'm gonna make sure that this blue Salem sump ribbon is above my patient's stomach. Is above my patient's stomach. Okay, so now I would lower the head of the bed to no lower than 30 degrees. I'm gonna raise the side rail back up. I'm gonna make sure the call light is in reach. I'm gonna clean up my supplies. Okay, so after I clean up my supplies, I would document the type and size of the tube, the time, the nair I used, color, consistency of secretions, and amount. So now I'm going to move on to removing. So to remove, I'm going to check the order, perform hand hygiene. Normally I would not have these gloves on because of course this would be at a later time. So I have these gloves on. I would perform hand hygiene. Of course I don't have these gloves on. Then I would apply these clean gloves. So now I will remove the tape. I would kink the tube. like so. I don't know if you can see it, like so, and I would pull out smoothly. So I would dispose of this. It's stuck. I would ask the patient to hold their breath as I was doing that, and then after that I would perform oral hygiene, as well as document.